friends, I'm Dr. Saigeetha, practicing dermatologist in Coimbatore. I am here to talk about latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. And second, we have coming to International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issues that in resource poor settings. Optimal care refers to the evidence-based standard of care, and whereas essential standards refer to the minimum standards of care to allow the specification of essential standards of care for low resource settings. The AHA or ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, no ASCVD or 10 years CVD risk less than 10%. With stage 1 hypertension, blood pressure 130 to 139 is systolic and diastolic is 80 to 89. Management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate with severe COVID-19. A recent study, which appears in the Journal of the American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced acute respiratory distress syndrome. Lowering systolic blood pressure targets down to the 110 to less than 130 range, substantially reduced CV adverse effects in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk. Finding from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from threshold of 130 to 150 mercury with regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure. The 2018 European guidelines on the management of arterial hypertension recommend the diagnosis of hypertension should not only be dependent on office blood pressure. Thus, they may be considered as the most relevant measurement for estimating severe risk. For every 20/10 increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36% each. Next, most of the patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitor or ARB or calcium channel blockers or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. The NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If 1 lakh patients would have been received NDMA contaminated valsartan from Beijing White manufacturing site where the highest level of contaminants were found. Every day for 6 years, in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in this drug could lead to 8 additional cancer cases in 1 lakh patients. If they had taken the highest daily dose for over 4 years, valsartan recall accompanied by a significant increase in the rate of emergency department visit of +6%. The Hygia study represents the largest study that tested nighttime antihypertensive treatment in this trial. Chronotherapy was associated with a significant reduction in endpoints, including death. The Hygia chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerted a favorable CV risk reduction. The largest study included a total of 19,084 hypertension patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The respiratory rate reduction for CV events was significantly improved for the nighttime treatment when compared with awakening treatment. Thank you, one and all. Thanks a lot.